All right, for the next part of our assessment, we're going to do a whisper test. I'm going to stand behind you, and I'm going to get you to plug one ear at a time, and I'm going to say a couple of different numbers and letters, and you're going to repeat them back to me, okay?
Okay.
All right. All right, go with whichever one you want.
875.
No.
What?
We'll try it again.
Okay. B34.
There we go. Okay, we got one.
What was the first one?
It was A75.
Okay. C38.
Okay, yes, good job. All right, so maybe some slight hearing loss in the left ear, which is fine. A is a hard letter anyways.
A and A are very similar.
It was a hard letter. So the next thing I'm going to note is a couple of different assessments that we weren't able to do, which is the nose, the mouth, and then partial throat test. So with the throat, I would check your tonsils and check for redness and inflammation. And on a 0 to 4 scale, I would rate the size of your tonsils. A 2+ would be equal to normal, 0 being they're absent, so you've had your tonsils removed, and a 4 being they are touching your uvula. Speaking of the uvula, I would check and make sure that your uvula is midline and symmetrical. And then after that, I would check your mouth. I would check your tongue for the color and assess for any masses, or make sure there's no lesions, as well as palpating the tongue for any masses. I would check your gums, make sure they're pink and moist with no inflammation, and then I would go ahead and check your teeth as well. Ask about your general hygiene. Your upper jaw will be a little bit over your underjaw, as well as checking the number of teeth that you have. If you have your wisdom teeth, and just making sure that you're overall keeping good hygiene of your teeth. I would also note your lips, and if they're symmetrical, if they're pink and moist and there's no lesions, or any cracks, if anything like that. And then lastly, we would check your nose and make sure it's symmetrical and midline to the rest of your face, as well as the skin around it would be is consistent with your ethnical background. Make sure that there's no deformities or discharge, as well as test the potency. So we would get you to blow out through your nose. Make sure there was no pain or tenderness with that, as well as we would note the color of your. Sorry, my nose is itching just talking about it. Check your nasal septum. Make sure it's pink and moist with no inflammation, as well as no deviation or bleeding. And then we would palpate your sinuses, which I did earlier, above your mask. And then we would note if any discomfort throughout the assessment, as well as I would use my tool, and we would go and look inside your nose and make sure everything is where it's supposed to be. All right, so our patient is positioned 20 feet away from the eye chart where we will be doing the Snellen eye chart. So the first thing I'm going to get you to do you wear contacts or glasses?
I do.
Are you wearing contacts right now?
Yes.
Okay, perfect. So do you feel confident reading line 6?
Yes.
Okay, if you'll cover your right eye, and if you'll read this from front to back.
E, D, F, C, Z, P.
Okay.
This is my worst eye. F, E, L, O, P, Z, D.
Good. Do you want to try for number 8?
Yes.
Okay.
No.
Okay, so the patient has 20/25 vision in your left eye. And then if you will tell me what this color is.
Green.
And
red.
Perfect. So no color blindness as well in the left eye. All right, so if I'll get you to kind of reset, and then we're going to test your right eye. So we're going to start at the same position, but you're going to read from backwards to forwards.
Okay. P, Z, C, F, D, E. DZPOLE.
No.
No.
Okay, so again, the patient was rated at 20/25. Again,
Green, red.
all right, perfect. So 20/25 again in the right eye, which is a little bit lower than the normal.
I need to go back to the eye doctor.
She has stated that she is going to have another eye examination further along, which I can concur with and say that is probably something that needs to happen. Other than that, this will conclude your assessment. Do you have any questions or concerns for me?
No.
Perfect.